John Lundell of CrossFace Productions here. Joining me now is Dr. Peter Warinner. Earlier this year, Massachusetts tried to pass a law that required amateur MMA fighters to get MRIs done. And now, with the surge in cases of chronic traumatic encephalopathy, better known as CTE, those requirements aren't without merit. So he took the time out to join us. He has a new book coming out, or it's already out.
Right? It's out.
The Art of American Healthcare. It can be purchased on Amazon.com. We had the privilege of working with him at the last No Boundaries Muay Thai fights. He is also the lead clinician at the
CNS Multi-Specialty Clinic in Wellesley.
Awesome, yes. Doing groundbreaking work. Like I said, he was kind enough to take the time out to join us today. And this subject is obviously very, very touchy. He is also doing a presentation out in Arizona that he's going to be using some of our material to do. So like I said, he was kind enough to join us today. And again, thank you. Welcome.
Well, thank you for having me. I appreciate this time to chat with you about this topic. I feel so passionately about it.
Awesome. So just to kick things off, what is a concussion?
You know, a concussion has many definitions, but I like to describe it in three ways. Number one, it is a mechanism of injury. So the brain is sort of rattled within the skull, and you can think of it as being rotated, being knocked back and forth. Even blows to the body can put pressure through blood vessels that rattle the brain inside, even without getting hit in the head. So the mechanism of injury is one thing. Number two, it is you can think of it on a cellular level. The brain cells are disrupted in a certain way. Number three, you can consider it a clinical syndrome. So if those mechanical forces, that mechanism of injury, and the biological changes that occur on a cellular level pass a threshold where a person starts to have symptoms, well then there's the clinical emergence of concussion symptoms. Now this is often considered the mildest form of brain injury, but the word mild refers to the consequences, the long-term consequences. It's usually transient, everything goes away. But the symptoms are far from mild. They can be quite profound and disabling for days, weeks, and even months in some cases.
Now, when you see an athlete or somebody actually get knocked out, does that mean that they automatically have a concussion?
Good question. I would say they've experienced a concussive mechanism of injury, but they may not wind up having a concussive or concussion clinical syndrome afterwards. So we see a lot of times, and I'm sure you've seen it ringside, that people have a flash knockout. So they're hit in the head, they're basically knocked out. Before they hit the ground, they're actually regaining consciousness, and they can bounce right back and continue fighting. That's not a concussion.
So your offices are in Wellesley, but oftentimes you are the doctor on site at these MMA promotions. And how long have you been doing it?
I've been doing that about 7-8 years now. Ringside physician, both for boxing, MMA, mixed martial arts, and kickboxing.
Awesome. And are you a fan of the sport?
Absolutely a fan of the sport. And I think some of my colleagues would have a problem with that. So, my field is neurosurgery, neurology, neuromuscular medicine. A lot of doctors and even professional medical organizations have tried to ban such sports like boxing, MMA, football, things like that. I am not an advocate for banning these sports. As you say, I'm a fan of the sport, but my involvement is twofold. Not only because I'm a fan of the sport and I like working with these athletes, consider myself an athlete as well, but I like to not ban the sport, but improve the safety of the sport. So I feel like if doctors are involved, doctors who are interested in care and want to help these athletes perform more safely, that's what we should be doing. So I want to be a part of that solution of helping people to do this sport more safely, as opposed to just saying, well, it's too dangerous, let's ban it. And you can't ban it because it's going to go underground. It's still going to be there.
Yes, and that's another point I want to touch on also, is the fact that you're not going to stop barroom brawls or anything like that either. So can these, especially with the footage and everything, can they actually be used as maybe certain templates to treat certain traumas?
When we can access video of trauma that has occurred, whether it's sports-related trauma or other, it definitely helps us as physicians to be able to treat people. If we don't have that, we can still, treat people. We have ways of achieving that, but having the video access definitely helps us a lot.
Awesome. And how did you get into sports medicine?
Well, as I mentioned, I've been an athlete. I actually trained in boxing when I was in college. Did other sports. I played football, for many, many years. So again, I don't believe that we need to ban these things. There's been some recent reports where children, high school students, things like this, even collegiate students are participating less in sports like football. I don't believe we should be pulling everybody out from these sports, trying to quote unquote protect our children. I think that's a big mistake. I think there's tremendous benefits for sports participation, even contact sports, collision sports. So people need to do them safely, not just get out of them altogether.
Awesome. Another thing I want to touch on also, how important is it for patients, not just patients, but also athletes, especially athletes, just to be very honest with their doctors? Obviously, because this is such a prideful sport, especially in the thick of battle. A lot of times athletes would like to say, no, I'm fine, but they definitely get rattled. So whether it be after the fight or at some time, maybe even during, how important is it for them just to be honest?
Oh, you know as well as I that every boxer or MMA or kickboxing fighter, they're honest all the time. No, seriously, I have yet to meet a fighter or boxer in the ring or in the octagon who, when I'm called in to see them and I ask, how are you doing? Or are you okay? Yes, I'm fine. Let me up, even if they're not fine. So yes, I would encourage honesty, and it's, for the fighter or the boxer's own protection, live to fight another day, sort of thing. Sometimes the initial injury wounds a person in such a way that if they continue, now they're continuing at a disadvantage, and the next injury can be so much more serious. And that's the problem. I think the wisest MMA fighters are those who know when to tap out. When in doubt, tap out.
So would you, or has there ever been a case where after a fight, one of the athletes did come up to you and say, hey, I did kind of get rattled?
Yeah, I mean, it's usually not during the fight, because you're right, the adrenaline's going, the pride, they just want to keep going. But afterwards, it may not be the fighter, but sometimes the corner people or the family members or someone will say, I know something's not right here. We need to take another look. And that's why I often, even when I do the post-fight physicals, and other physicians, like me, we usually ask someone to hang around. Don't just leave right after. Just hang around so we can observe, see how things evolve over the coming minutes and hours, because sometimes the injuries are not immediately obvious.
That's true. What studies have you been conducting or having taken part in with regards to CTE?
CTE, chronic traumatic encephalopathy, used to be called dementia pugilistica. It's something that has been described in medical literature for thousands of years. This has been recognized in ancient Greece. So it's been around for quite a while. Modern science and pathological analysis has identified this condition that is currently being called chronic traumatic encephalopathy as, there's a protein called tau, T-A-U, that gets deposited in the brain in an abnormal pattern. And that's the true underlying pathology that's associated with, I don't know about cause and effect relationship. And so we know that this is a very real disease state entity. We really don't know how it occurs. Now, it is being said, even by knowledgeable scientists and doctors, that there is a direct cause and effect relationship between concussions, multiple concussions, and getting CTE. We really don't know that yet. I believe there's a strong genetic role that we have yet to understand, because there are similar entities that occur in people who have never had any trauma. The jury is still out on whether this is caused by head trauma or not. I believe head trauma is related to some extent, but let me tell you this. Even in those cases where people have been found to have CTE on autopsy after they've died or committed suicide or something like this, this is a very serious problem. But I would offer that many of these people, it's just as possible that they were going to wind up with that fate, whether they participated in football or boxing or MMA, especially if there truly is a genetic relationship.
So it can be hereditary.
I believe it is. We don't know this yet, but I believe it has a genetic relationship. And I also believe that some of these people need, let's call it maybe a violent outlet, boxing, MMA, football, something more aggressive, an outlet for a pre-existing condition. So it's very possible, and I believe this to be true, that if these individuals did not participate in the sports, that they would actually have a worse life and perhaps a shorter life.
So linked to the what's kind of known now as the warrior gene. Right?
I think there's something to that, and participating in organized sports allows them an outlet. Otherwise, they might wind up being violent criminals and in jail or dead.
It takes us back to obviously the hunter-gatherer times of the Pliocene era and all that. The caveman era.
Yeah, something to it, I'm sure.
Awesome. What's the presentation you're doing in Arizona?
So it's coming up in a few weeks, and it's on neuromuscular medicine. And in this case, it has nothing to do with head trauma and concussions, but athletes can experience neurologic damage, nerve injuries. So, get an arm bar, and okay, we're worried about dislocated shoulders, but there's also nerves that go through. There's something called the brachial plexus, like brachial plexopathy, or guillotine or other chokeholds where you can have neck injuries and damage to the spinal cord and nerves coming out from the spinal cord. So it's going to be presentations like that. Also, dealing with metabolic issues like rhabdomyolysis.
What is rhabdomyolysis? You just said.
Yeah. So muscle, when it's exercised, when it's hit, can get damaged in such a way that it spews its inner contents out into the bloodstream, something called CPK or CK, creatine kinase. It's a muscle enzyme. And it happens to a certain extent to all of us during various exercises. And there's a lot of genetic varieties too, so some people are more predisposed to releasing CK than others. But when that CK level rises to an extreme amount, and coupled with dehydration, either leading up to the event or during the event, and if it's very hot, for example, that's why we have to be cautious about not participating in 100-degree high humidity situations. So that CK rises to such a level in the bloodstream that it's such a burden on the kidneys that the kidneys start to shut down and other organs start to shut down. It can then there's a cascade of horrible events that start to take place within someone's body. Then it can affect cardiac conduction, and, the heart rhythm and beat, and then it can start to affect the brain. The brain can swell, and it can have a fatal outcome. It's very serious.
So we are recording this live at BST MMA and Fitness in Mendon, Mass. And there's two fighters that come out here, two pro fighters, Chris Matino and Rich Santiago. Chris Matino actually just won the first sanctioned Muay Thai fight, professional Muay Thai fight in Mansfield, Massachusetts. He trains out of this gym, and with cases like rhabdo and stuff like that, with these with spikes in these gyms with this high intensity type of training, you don't have to be a professional athlete to get rhabdo, right? You can get it just from doing workouts that you're not used to.
There was a recently published article I read about a month ago that was occurring in spin classes at regular gyms. So you get people in a hot room and you're just exercising. There's a strong genetic component here. Some people are just much more susceptible than others. So if anybody's concerned about this, the doctors can check them out to check for a predisposition. Something, for example, is just checking the CK levels at baseline, and then with substantial exercise, rechecking it to see where a person's at.
And would you suggest that even athletes too, to get their blood work done before certain, like even if it's not required of the physical itself, just to get your blood work done?
Absolutely. I think checking things like CK and often also urine-specific gravity with there are other tests that can be done on blood and urine, and you could do baselines, you could do post-exercise, and I think each individual, if they're serious about it, obviously there are expenses involved, healthcare costs, and some are covered by insurance and not, but in an ideal world, these things can be checked.
Can they go to, let's say, like an urgent care place and request those? Or?
I doubt it. Yeah, this is something that you'd have to be most likely special. Primary care could possibly do it. These are not, in most cases, considered urgent issues unless it's after a fight, or if you're in a gym, even if you're not an athlete and you're just working out in a gym and you're concerned, you could wind up in an urgent care, and that is something they should be checking.
What other imaging things can be used in neurology? We was talking about fMRIs a little bit earlier, but you said there's other things that are actually better.
Yeah, so functional MRI, fMRI, is an interesting tool, and over the past decade or so it's been rising as an interesting, mostly a research tool. It's not so easily commercially available, so doctors can't easily order it, patients can't easily request it unless you want to pay for it on your own. But there are other imaging modalities that I think are very important, and some of the concepts that have motivated the recent request for changing the laws or regulations in Massachusetts for amateur fighters to get imaging is because there are pre-existing conditions. And most of the catastrophic problems and even death that occurs from head injury in these sports are from pre-existing conditions. So for example, like a vascular or blood vessel abnormality that then ruptures during a fight, but if you didn't do the right kind of imaging, you wouldn't know that you had it. Most pros are getting imaging, so you want to get a basic CAT scan and what's called a CT angiogram, and that can just look at bone structures, general brain structures, bleeding and blood vessel issues at a baseline. But thinking of tracking someone over time that might be concerned that, okay, they had some initial imaging and there were no major problems that represented a pre-existing condition that was dangerous, but you want to follow what has happened over my career where I've been hit in the head a number of times. And so we would look at MRI technology, regular MRI technology, but there's something called diffusion tensor imaging, which can actually track the interconnectivity between nerve cells throughout the brain, and that's something that can be tracked over time. There's something called quantitative volumetric analysis, which actually measures in each individual the brain volume of certain key components of the brain, and then we can measure it later in time to see how that has changed. And it's not only compared from one point in time to another point in time, but it's compared relative to other people at the same age. So everyone's brains are changing over time, especially as you get older, they're shrinking. So it's important to compare these to peers.
Oh, wow. So without disclosing any, obviously, personal information, there was just recently a case where you had a fighter flown out to Massachusetts and he was actually required to get an MRI, and then he was not cleared because there was some pre-existing stuff, right? It probably saved his life.
Yeah, I encountered this many times. There was a case recently where a particular individual had, we'll call it a mass in the brain, and he was an amateur wanting to go pro, and it's a very dangerous situation. And he had fought a couple of fights, but he was very lucky because this is something that could wind up in a catastrophic outcome if he should get hit in a certain way.
So now, how has neurology changed the way you view life in general?
Well, I see when I look at a person, I don't see the skin, the bones, the hair color. It's not like Superman with X-ray vision. I'm seeing the brain, the spinal cord, the nerve. So let me see your arm there. When I see your arm, I see your brachial plexus cutting through here. I see your radial nerve, your median nerve, your ulnar nerve. I see your biceps muscle and underneath the skin, and I understand how it all connects together and how it works. So that's how I view a person. And then I'm watching fighters in the ring. I'm not thinking, oh, he's in an arm bar. I'm thinking of his brachial plexus, or, you know, when he's in a guillotine choke, I'm thinking, you know, what's going on with that spinal cord, you know? So it enables me to have a very unique perspective on life and on people.
It's funny because you think about fighters too, they're thinking the same thing, just in a different way. You know, he's leaving his jaw open, you know, he's got his arm dropped, you know, if I can get my leg around his neck, I can choke him. But as a doctor, you know, it's funny, it's the similarities and it's definitely parallels. So when you watch football or something, or even any kind of, not just combat sports, but just full contact sports in general, has your studies changed the way you view those now?
Well, absolutely. You know, it's sometimes the concussion or the certain blow to the body is very obvious, but many times it's not. So sometimes I'll get involved in, for example, in, you know, professional football players, and I'll get involved in their care, and we'll view the tapes and we'll see, you can't see an obvious concussion, but yet they were carried off the field. So it's not always very obvious, and that's the thing. Is, you know, yes, we're looking, when it's very obvious, then that's easier. When it's not so obvious, it's much more difficult. So as I said earlier, it's not just getting a blow to the head. Sometimes a body blow can result in a concussive problem. Sometimes just taking a tumble. You know, like track racers, you know, runners. That's not a collision sport, but they can wind up with concussions. Gymnasts, you know, tumbling. They can wind up with concussions as well.
Wrestlers.
And so we do, yeah, wrestlers. So, you know, we need to analyze it in many ways.
So on the 30th of July, the MMA community was definitely shocked by the death of Rondell Clark. After being taken out by an ambulance right before the end of the third round of his second amateur fight, he was treated for exhaustion. The mysterious news of his death still it kind of reverberates in the community today, and the cause of death is still in question. So given what you might know about that event, what would your opinion be?
Yeah, so I can't speak to this particular individual, and it's absolutely tragic. This is what we do not want to occur, and this is what all of us struggle and strive to prevent. So having said that, I think the concept of informed consent is very important. Everybody that gets into the cage or steps into the ring needs to understand that there is the potential for a fatal outcome for so many reasons, not just a blow to the head, not just you know, some catastrophic organ or heart injury, but you know, other things too that may defy our understanding. Sometimes it's very unique situations to the individual that we, no matter what we do, we cannot predict. So, you know, recently we're talking about requiring more testing prior to people competing, even for amateurs. But I can tell you now that all the testing in the world, if we did all the testing that we ideally would like to do, and there's so much more that we can do, and many physicians believe we should be doing, even if we do everything, there is most likely still going to be some bad outcomes and death, because the nature of the sport. But I think as long as a person understands stepping into the competition that this can happen, and they still want to go ahead with it, you know, they're adults. It's their decision.
So we're going to take a break and take a look at the clip from Chris Makino's fight, the first sanctioned pro Muay Thai fight, that took place in Mansfield. The doctor was there during this fight, and then he actually grabbed a clip of him in action, so to speak. So we're going to take a break and show that clip. All right, so with that, obviously, tremendous blow to the liver, what are you looking for? What are you asking that person they're experiencing?
Well, in general, with whether it's punches, kicks, or knees, sometimes they're intended to go there, sometimes they're not, and they just wind up there. But the proverbial liver shot is very often the shot that stops a fight. And these blows to the liver sometimes aren't immediately felt. So a fighter will get hit, and then it might take a few seconds delay before they realize enormous pain. It's a very painful shot. And it's interesting because I think people who watch fights, and it's sometimes very obvious when someone gets that blow to the face, and it's very dramatic, and someone goes down, they can understand how you might want be stopping a fight for like a TKO or something like that. But with this blow to the liver, it's sometimes very subtle, and and then all of a sudden someone's like writhing in agony, and you wonder, is he faking it? I've heard that a lot. But this is something that is extraordinarily painful. The fighter cannot go on in cases like this. It's fairly common. And my concern is internal organ damage and like a ruptured spleen and internal bleeding. So I'm very concerned about these cases. So I want them to stay there for a long time, and I want to look at them again and again. I'll call them the next day, 2 days later, make sure they're okay, because and I'll have a fairly low threshold to send them to the hospital, because internal bleeding can be catastrophic. Yeah.
Do you believe, as a doctor, in patients getting a second opinion? I know, in your cases, a lot of times you are the second opinion, but do you encourage that with your own patients?
Absolutely. I think, speaking beyond athletes and patient athletes, all patients, I believe, are entitled to and probably should seek second, third opinions, especially if there's something very complex. And I think we as physicians need to be gracious and understand that we can render an opinion, but we don't always know with 100% certainty what's going on. And sometimes having multiple doctors taking a look at the situation, maybe one doctor will see a part of it, another doctor will see another angle. So putting all of those eyes together is in the best interest of the patient. I always encourage it, absolutely.
So now, do you also encourage others that practice in medicine to view their patients as human beings and not just as subjects, so to speak?
Definitely. This is, I think, a problem in medicine today, and it's getting worse, not better. The concept of holistic medicine is not alternative medicine. It is something where MDs, medical doctors, should be engaging in. It is impossible to understand and fully treat a person who has a medical diagnosis if you treat them just based on the diagnosis. I think it's problematic when doctors finally arrive at a diagnostic conclusion, and then instead of then looking further into the details of a person's life, their family, their job, how are they sleeping, how are they eating, how does this impact their school or their work. If the doctor doesn't look into all of that, then you can't fully treat it. You can't just turn to the computer or the database or the medical textbook and say, oh, the patient has this diagnosis, and let's follow a recipe on how to prescribe for that person. No, it all has to be done uniquely tailored to the individual context of that person's life.
Awesome. And I checked out your website. Anything new on there that people should know about or should look into in your studies?
Well, cnsmultispecialtyclinic.com or cns.md for a shortcut, and it's constantly being updated with content. And welcome to reach out to me at any time. I'm happy to talk to anybody about anything. I'm very passionate about this topic.
Yes, and this is obviously a little bit lower key. You're also a guest host sometimes on the Howie Carr Show, right?
Yeah, at this point in time, I am the official healthcare consultant and medical doctor for the Howie Carr Show.
Awesome. Yeah, last one was Memorial Day, right?
Oh yeah, actually I was the guest host for the full 4 hours on Memorial Day.
Are you a big advocate for VA and also veterans getting health care?
Oh yeah, so that was a topic I covered on the day. So the VA healthcare system. Now you have some VAs that are very good and provide excellent care, but you have some VA systems or VA locations that are problematic. So we can't just blanket criticize, but I think veterans, very much like athletes, some of the injuries are similar, but these people selflessly, for very low pay, if you think about it, put their lives on their lines, and I think we as American citizens should be giving them top-notch health care, not bottom shelf, and that's what they're getting. So I'd like to see that turned all the way around.
Awesome. This has been a great talk. We recorded live at BSD, which is short for Blood, Sweat, and Tears, MMA and Fitness in Mendon, Mass. Stay up to date on our website, CrossFaceProductions.com, as we'll be putting up local offices that provide affordable health care for athletes, hopefully affordable MRIs too. That is soon to be announced, and physical stuff like that. Also, you can see the remarkable work that Dr. Warinner is doing on his website, cnsmultispecialtyclinic.com or cns.md for short. You can also purchase his book, The Art of American Healthcare, on Amazon now. Definitely fascinating stuff. Definitely a great view on American healthcare and the things we can do actually to make it better today. We are giving you a gift, the CrossFace Productions Evolution of a Cage Titan book. There you go, Doctor. Thank you so much.
Thank you very much.
Thank you for joining us so much. Have a great day.